Assessment of customer cases are quite complex and involve nursing and medical collaboration. From that and the medical information we receive from the doctor overseas, if the customer needs assistance with mobility, pain relief, toileting, they may need readmission and rehab on their return home, then we would start the plan for repatriation of the customer. Organising a medical repatriation is quite a detailed and complex process. It usually commences once we've monitored the customer's condition overseas and their treatment. We undertake a detailed nursing assessment, and we would usually try to speak with the medical practitioner who's managing the customer's care overseas to determine what the requirements would be for a safe retrieval home. Based on the information we receive from that medical practitioner and from the detailed nursing assessment, our medical consultant would then review that information and assist us in determining the needs and requirements for our customer to safely return home. Based on that recommendation, we would then go out to obtain specific quoting based on those requirements for the safe retrieval home. In that, we would then be planning to move the customer from their current place of care, arranging the ground arrangements and air clearances and air transfers to their destination, including the ground arrangements and their admission and follow-up care following their return home. We liaise with a wide variety of services and service providers within our network. Primarily, one of the biggest groups that we utilise to arrange a repatriation would be our IAG network, because they're best placed to comment on the facilities we're able to provide, especially ground arrangements and air. They have medical teams as well, so they can assist us in providing a quote. Aside from them, we utilise credential providers that undertake this type of service, repatriation in an aviation background, or perhaps repatriation on the ground or an air ambulance. We have a wide variety of those groups around the world that we seek consultation with for service provision. So for air ambulance evacuations in the last 10 months, we're sitting around 40 cases. We have moved 93 patients or customers by helicopter in remote locations. A lot of these are Nepal. It is hiking season, so for roughly a 2-month period we do get a large number of helicopter evacuations in that destination, primarily due to mountain sickness, often coupled with other illnesses to go with that. So they might have high altitude pulmonary edema or cerebral edema. They're brought to lower altitude to attend care. We've had 99 commercial retrievals in business class, medically escorted, and 29 stretchers commercially with a medical team. There's always 2 staff members that attend to a stretcher on board a commercial aircraft. That can compromise either a doctor and nurse or 2 nursing staff. If a patient needs to be repatriated, they can expect detailed nursing involvement and medical consultation on their case. We would gain their consent, involve their family, and plan to transfer them from their current admission right through to either their home destination or arrange their admission in Australia. All of the arrangements for the repatriation are taken care of by the retrieval team or by the medical assistance team, whomever is undertaking the mission.